the development of the One Health Scorecard within the last few years of TDR projects. And I wanted to start, wanted to kind of start with what Paul just left with, basically a short foundation of One Health approaches. That is, what are the key elements? Mine are just a little bit different, but basically same idea. What are the key elements? First of all, systems thinking, which we may not forget that we are talking about complex adaptive systems. So we have a couple of, this is, by the way, a slide from the lit curriculum that we did. So complexity has features of multiple hierarchies, components, nestedness, interrelations between hierarchies, and so on. Adaptiveness, here exemplified by the panarchy, that systems adapt to connectedness and potential. Then we have non-linearity in behavior, and we have emergence of properties that on higher levels that can not be explained by the sum of elements that are of lower levels. So those are key features of complex adaptive systems that always should be kept in mind. Then we have adaptive management. As systems are evolving, as risk is evolving, the management has to evolve appropriately. Then we have evolving organization in order to work on or even analyze adapting systems and adapting risk. You also need a co-evolving organization in order to be able to face these. We have generative learning. So through interdisciplinary research with external stakeholders, that is not scientific stakeholders, and creative approaches, you actually generate new knowledge that can lead to innovations that gets incorporated into the organization and takes the whole topic forward. We have community participation, which is a process from like just mere representation of a community to actually autonomy of a community, where they set the agenda and call the shots. So that those are 2 points combined from Paul's list. And transdisciplinarity, which does not work without systems thinking, which does not work without community participation. And as it's meant to create value creation in terms of real world problems, of course, also includes the other parts. Okay, so as for the problem statement of One Health operationalization, how can we properly plan, implement, and evaluate One Health approaches? Well, the ideal would be One Health approaches that empower the community to build and sustain the adaptive capacity to evaluate local health risks, implement threat management, and generate knowledge in the process. From what Paul just presented, his community is all the way there. It sounded really nice. That would be the ideal, but I mean, this is a really ideal project that Paul just presented. So the reality oftentimes is risk assessment and prioritization is rarely led by the community, but comes from outside, top down. The involvement of scientific disciplines is rarely demand driven. Also, like a scientific discipline asks for funding and creates a project, and it's not at all demand driven by the community. Research-led interventions generally focus more on publishable output than on community empowerment. Well, that's something to do with the whole research system. And funding institutions aim for evidence of reduction in epidemiological data of a certain disease that is reactive. You know, there is a problem, see that you can reduce the problem and in 3 years go, rather than for building adaptive local organizational competencies for sustainable risk reduction that is preemptive. Which goes more in the direction also what Paul just presented of evaluating, estimating the risk, monitoring the risk. Yeah, and of course then adaptive management. So what are the consequences of all these problems? Is there is little or superficial support of the community during interventions because they are not onboarded, they are not involved, they are not empowered. There's little to no empowerment of the community to build and sustain adaptive capacity. So, you know, they're just being brought onto a project and then the project ends and that's it. That creates questionable research output and temporary intervention outcomes due to the limited time in individual projects, which again creates then growing disinterest, resentment in communities to participate in anything at all. And then the whole big problem is that there's undetected and uncontrolled systemic infectious risk. So yeah, so it's nice to see that you presented projects where you work with a community for a longer time. You start at the beginning, and you take the community stepwise forward so that there's actually a sustainable outcome. So the proposal here was to create a framework for guidance on planning, implementing, measuring, and evaluating One Health approaches to ensure the long-term maturity in terms of systems thinking, transdisciplinarity, adaptive management, adaptive organization, generative learning, and community empowerment. So looking at these fundamentals of One Health approach, how can you take a community over a longer term to mature, to empower them in these different areas in order to get a sustainable well-being. Okay, let's quickly look at, time is running, quickly look at the components of an adaptive One Health approach. We have in the middle here is the systems analysis, because if you don't analyze the systems, you don't understand the interactions, you cannot evaluate system behavior, then I don't know what you're doing at all. So you need all that in order to do risk assessment at all. You should base your research questions on this, and the system analysis should be performed together with the communities, of course. Also, as Paul mentioned, there is changing priorities, of course, in the communities. So you have to see that the risk and the prioritizations in the community somehow match, ideally. And then from the system analysis, you can go into the intervention management and careful planning, implementation, evaluation, adaptation in order to then evaluate the system again. So this is an ever-going process that does not benefit that much from like single projects unless you've developed a community that is completely autonomous in all of this already. So we went ahead with like how do you start? So with different African projects, we went ahead with building logic models. As I remember, every project had their own logic model that they followed. This is just a general one that is from the recognition of disease threat. You need to first build the capacity, that is the capabilities and the skills in order to build an organizational setup that is actually able to execute or implement these competencies. And then you can go about system analysis and implementation and adaptive management and all that for long-term outcome. Now, of course, this is not one straight line. Like as soon as you are here and you're doing systems analysis or research or whatever, that there should in theory go arrows go back to like any of these to follow this line again. So this is an initial one, and then from there you have all kinds of grouping back. Okay, quick introduction. So much for One Health approach. A quick introduction to scorecards. Now we go over there. Like what's the rationale of scorecards? Scorecards are a management tool for building and sustaining core competencies. that is the success of an organization depends on an organization is successful when it offers specific resources, products, or services that are either cheaper or of higher quality than those of its competitors. That's the rationale originally of scorecards. So you have effectiveness and efficiency, which also applies to One Health projects. The success factors is organizations develop internal core competencies that are key to their current success. Building, securing, and strengthening them is the foundation of any successful strategy. So there you have core competencies, which we also saw in the logic model I just presented, and then with the aim of having a sustainable approach. Then managing the success factors, core competencies are made of a multitude of key capacities and capabilities. We've also seen them in the logic model, enabled by organizational and managerial frameworks, processes, tools. Therefore, evaluating success requires evaluating the performance of essential success components for several perspectives. So breaking down the core competencies into different perspectives and components, and then measurements to derive key performance indicators where you can measure the core competencies of an organization or essentially the progress of a One Health approach. So what's the rationale for developing a One Health scorecard? Let's look at this per project phase. In the planning phase, design project according to the operational state and maturity requirements of a local One Health approach and in alignment with the communities. So if you're planning something, align with the communities. If you have the One Health scorecard, you know exactly where you were left off or where they are currently. So you can build on that and look at the areas that are so far underrepresented or that need some enhancement in order to take the community a step further. So this is demand-driven and collaborative. Then we have the implementation phase, build on the organizational development within communities to design, plan, implement, evaluate, and adapt local interventions, collaborate with an enabled community to identify relevant research questions. So here we have an enabled community that's supportive. And then in the evaluation phase, measure progress and evaluate projects not based on isolated ecological, social, or epidemiological figures. So not just like, did the incidence or prevalence go down, but based on the impact on local systems, the collaboration with communities, and the maturation of the local One Health approach. So there we have a maturing One Health setup that leads to sustainable outcomes. What's the time? Okay, I speed up a little. What are some examples of scorecards? In the corporate field, we have classic corporate. The point here is that these different perspectives are enabling. So you need to learn and grow internally in order to create your internal processes, to serve the customer, to make financials. So there's a clear logic here. We're looking at public administration. We have here culture and capacity, enabling the internal processes, serving citizens and administration. And finance is a little different because citizens are not just customers. Then we have corporate sustainability, where we have three different perspectives: environmental, economic, social. Now this already brings us a little bit in direction of One Health, actually. And if we review the core competencies of adaptive One Health approach that are needed in order to build the capacity, or they are directly interlinked, in order to be able to perform intervention science that enables you to do risk management at all in order to lower impact and risk. So what does a One Health scorecard then look like? Well, this was the result of our structure and interrelation of the One Health scorecard. We have here 4 perspectives: capacity, intervention science, risk management, and impact and risk. This as an indicator of the risk of a certain disease at a local local community, and these as key perspectives of the local One Health approach. And as a quick example of what a KPI would look like, because you cannot just measure an organization as 20 centimeters, but it's always a qualitative progress in different aspects of the One Health approach. So we'll look at capacity, organization, and rather knowledge, like how is knowledge being managed within the approach. So we have different scores. It starts with analysis of essential knowledge and skills. Then we have the compilation, establishment of knowledge management training and skills. We have a provisioning and enhancement of role-specific knowledge and skills. We have the generation. This is actually now the generation of new knowledge. Now we already got to knowledge generation, and the highest score is then the innovation that follows from that. So the idea is to bring any local approach as high as possible over time. Nobody starts on top. This is an example of a One Health scorecard now with actual scores by the different perspective and their components. Underneath there's the actual KPIs that you don't see now. This is a number rating. This could be interesting if you're looking at a specific area or a specific disease and you compare your project to others, and you can see, okay, what are other projects doing differently? Of course, what is more interesting, how did they derive the score? So what is the supporting information and documents and tools that lie behind a scoring? Okay, so the way forward can be multifold. One is the analysis of concluded projects using the One Health scorecard. So applying the One Health scorecard to concluded projects to evaluate the current or achieved maturity at local communities to identify gaps in the project design or for designing future projects. For an analysis of ongoing projects, basically the same, just that you can take some corrective action where it's not necessarily correction, but like extension maybe of the scope or inclusion of something else before the project ends, and you can explain why, or what was the advantage of that. And utilization for planning future projects, that is applying the One Health scorecard to identify One Health fundamentals and receive guidance and stepwise capacity building and development of local competencies. Yeah, and then collecting that on the One Health scorecard platform, you'd have the reference, that is, you can utilize the One Health scorecard collaboration platform for capacity building to identify projects facing the same challenges or to learn from other projects in terms of applied methods, models, tools, and approaches. From all this, there's also, of course, a multitude of publications that could derive from this, like something like which maturation in terms of a sustainable One Health approach did the project achieve? Why didn't it achieve it? Or what didn't they achieve? An analysis of further capacity building demands in the local community, or a description of One Health enablement during project XY, or benchmarking with other projects, putting achievements in a perspective, discussing differences, learning from other projects, applying the One Health approach in the same or a different way with similar or different results, or challenges of designing One Health projects in specific settings and how to overcome them. So the whole point is looking at a way to help future projects or ongoing projects in doing a real holistic One Health approach and providing the resources in order to have the information to do so. Okay.